All right, we are live today. Welcome, welcome. Welcome everyone to our conversations with mental health professionals during this time during the pandemic. Just really happy to have a great guest on today. And before I get into the introductions, I just wanted to just talk a little bit about why these conversations started up. Really, so initially we were really just thinking about um, why these conversations were needed. I usually have these casual conversations, but they're very informal all the time with my peers, and really felt the information being shared could help those out. Maybe those who are in the field, those who may be struggling to ask for help, or maybe those who are just kind of wondering like what's going on behind the scenes in terms of like dependency and the court system and mental health and social services. So that's really where this thing started. Um, but actually, there was a huge sign that there was a need, actually. And I'm just going to talk about that a little bit. One of the main things that I recognized is I put out an inquiry through various platforms, through different forums and podcasts and social media platforms, really to just inquire on if anyone wants to participate or share their experience as a professional in this field. And I got several responses. I mean, it was a lot of responses from people, and that was an indicator, really, that there's a lot that needs to be said on mental health. And in addition to things need to be said on mental health, there's not enough platforms to share those things. So that was one of the main indicators of that. So just a little bit about myself for anyone that doesn't know. I'm trained by trade as a registered MFT, registered under the Board of Behavioral Sciences, and I practice also in the health and wellness and coaching field as well, and have over 20 years of experience, clinical experience, working in the behavioral health field across a variety of settings, vulnerable populations, working as a clinician for Solano County, inpatient and outpatient youth, and also the adult clinics in the Sacramento County's inpatient unit. I worked as a social worker under the Family Reunification for Sacramento County Child Protective Services, so CPS. I've also worked in terms of doing with various state agencies such as CDPH, Office of Health Equity, overseeing various community mental health business organizations that use MHSA funds to provide services to communities of color. Also, I served as lead project manager for other state agencies, for example, Department of Healthcare Services, helping them with their quality control for Medi-Cal, improvement compliance reviews for mental health and substance abuse plans. So also worked in the legislature in certain other roles, but enough about me. We want to talk about our guest here, and we want for her to share a little bit about her. So I'm happy to have here Melissa Earls. She's the Deputy Counsel for LA County Department of Children and Family Services. And I'm just going to turn it over to her to let her introduce herself and talk a little bit about what she does.
Hi, everybody. My name is Melissa Earls. Now I work for Los Angeles County, the Department of Children and Family Services. I essentially represent the department in dependency proceedings. Prior to that, I worked for years as a supervising social worker for the Children's Law Center of California. And prior to that, a case here 5 years. I've spent my entire legal career independently. It's something that I have always been passionate about rights. I actually came from a local economic neighborhood. I knew a lot of friends who them and been outside to get outside and have a seat at the table and be able to help now. So the children's law, I definitely love helping, especially navigate. A lot of time, a lot of this are being implemented in children's lives. They don't have the process at all. They don't have a so that is great about the law center. California is the good attorneys a voice to and the role is a little, it still helps in a different way in that I provide advice to workers and the County of Los what way law provides them to go about things and change to being the voice, but also the child while being of in the environment, whether it's in home, outside of the and ensure workers are out and are aware for them making safe decisions.
Mm-hmm.
Part of my day, a trial, I'm in trial. So that's a little bit about.
Well, thank you very much. And also, you also worked a little bit with DCSS back in the day, a little bit, right? Working in social services.
That
was pre-attorney days.
I volunteered one summer.
Volunteered, yeah.
Ombudsman for one, so I didn't work really, but I did volunteer for the foster care ombudsman because I was trying to determine what I wanted to do once I graduated. But primarily in undergraduate school, my focus was on educational opportunities for low socioeconomic neighborhoods and communities.
Mm-hmm.
Yeah.
Well, thank you for coming and joining us today, and let's get right into it. I just had a couple things I thought would be good to talk about. Really looking at just the state of what's going on in the county right now and what's going on in the courts. And so just a question for you. So can you just talk a little bit about the status of how mental health is being treated and, you know, what you're seeing in the court system, and do you see any behavioral health, social or systematic trends when it comes to youth and transitional age youth accessing services during COVID-19?
So right now, of course, for all people, everything is a lot more complicated, and the way each agency delivers is different. So I have, when I'm reviewing reports, some agents are still going out and providing direct services to you. Other agents have to host virtual sessions with the minors to concerns over 19. So I think depending on what is and how they interpret the state mandate will depend on is training. I believe that essentially March, May, I would say March, June, there's a backlog of referrals just because we were still referring families, but agencies were not providing services. So now agencies, just like all other, like the DMV, going back and they are processing the older referrals first and allow families to access this than before.
So it sounds like there's like there was a backlog prior with the referrals, and now there's a whole new load of referrals. And just in terms of referrals, and just curious, in what ways are referrals coming in if they didn't before? Are you seeing like since COVID-19 hit and there's, you know, people were at home and things of that sort? Are there other ways you're seeing referrals coming in that it didn't come in before?
When you're talking about referrals, exactly, are you talking about like the department referring services, or are you talking about like hotline calls?
Both.
Okay. So during majority of the quarantine, I would say we were still averaging the same amount of hotline calls. It seems that sometimes there's an influx. I think the way calls are coming is different now. Even though truthfully, a lot of times referrals are generated through school, but right now. However, there's is a trend in that sometimes I think we are having officials reporting concerning incidents due to Zoom calls. Talking with other friends who are in the education field, children are on Zoom and they're telling
Mhm.
things like, hold on, because my parents are fighting again. I think that there have been referrals because there's been, I think there is evidence that maybe a parent physically child, even cameras on. So I think that with change in the way society is communicating, the way children are going to school, Zoom is providing an interesting way for referrals to, and I thought initially we thought that we left referrals this time because we're not going to school to see what's happening in terms of marks or bruises or, lethargic or what concerns that we have for the safety of children. Nonetheless, because generally people who are struggling with anger issues or domestic violence, they don't stop. Unfortunately for them, they don't realize that that might not be appropriate when a Zoom class is going.
I see. And with that, I'm sure some things have changed, right, in terms of seeing those things and, with social workers, working in that field and seeing those new issues come up. I'm sure that's being addressed in some kind of way within the field, hopefully through with the social workers and caseworkers.
Um, Again, anytime a call comes in, it's either a 5-day or a 10-day referral. If we have any kind of concern comes into the hotline, the social worker automatically go and evaluate.
Mm,
So even though maybe the mechanism of referrals are coming in, but the department continues to use the same methods that it used before, department representatives go out and get an investigation.
I see. And usually like with court, right? Like we're usually used to like going to a physical place, right? And going to a hearing and sitting in front of a judge and being in the courtroom. How does that look now? Just with COVID-19 and not being able to sit in the courtroom, and yet you still have to have these hearings that go on. So can you just talk a little bit about how the court, the new system works now virtually?
So now, the courts essentially are not having people come in, the only ones who are being brought in are if they are in local custody, meaning county custody. Um, they are in state custody, then those parents are not brought in. So the only ones that are in the courtroom right now are the judge, staff, and court reporters. I mean, court officers are known as basically in-court social workers, and they take the notes and provide direct information to the court. So if the court is limited who is in the courtroom with the judges. So in general, and parties are not allowed. However, if a child testimony difficult for a justified period, need to try and be a WebEx out somebody. So if child needs to testify, they go to the courtroom and testify. So only incarcerated parents in custody, and then children, if need to, can be brought in. They testify, are present with. Otherwise, everything is via WebEx, which is like a legal Zoom, I would say. So when we have our provider department, they will give you a call to contact you. Will either give you so that parent or party click on the link, access their advice to call in number, and are completing as we did before. We're taking tests, but everything online.
I see. I see. And I'm sure that's a change for everyone out there, for the professionals working in the field and also the youth. being involved, and also you're dealing with the mental health components to being on camera with some of the youth too. So for example, you may have some youth that are ADHD or may have some psychotic disorders, and being in front of a screen, sometimes can be very triggering for them. So there's a whole nother component dealing with just being in front of camera for youth too. So I can see a lot of those issues coming up.
And I think that's why we're allowed, or the mic actually is given the discretion to decide whether or not to meet their client in court,
Mm-hmm.
testify in person. And it all depends on the child and their trauma history you indicated.
All right, so I'm gonna switch gears here. Now I'm gonna let you ask me some questions. I know you just in terms of the I know earlier we were talking about assessments, and how does that look for some of the youth and assessments, and what type of criteria is being considered with social workers and these caseworkers who are working with the youth. So I'm going to bring up, let's see here. Bring up a assessment tool that that's pretty well known, used in the mental health field. Give me a second. There we go. Let's share. All right. Okay, so this here is just a basically a diagram, and is that big enough on your end?
Yes.
Let's make that a little bigger. Okay, there we go. So I think this here is one of the main tools. And I'm speaking in terms of mental health, and I know within certain counties there's been a lot of merging of mental health and the behavioral health and substance use and social services in terms of how they work together. But for a lot of the mental health clinicians, there's a CANS 50, basically the California Child and Adolescent and Strengths tool that's used to determine medical necessity. And this is a standard tool that's used throughout many of the counties who administer Medi-Cal mental health services. And it really goes through basically it's a CANS 50, so it's 50 questions. They're really a tool to use to see where the youth is at in terms of each area of their life. So for example, you see for like child behavioral emotional needs here, there's a scoring system. So basically you have a clinician sitting down with this youth right in front of them, or now probably virtually, and they're going through this assessment tool with the youth and also their caregiver. So you may have some of the items, like for example, one psychosis, you will kind of not more of an interview, but more of a one-on-one discussion to find out where they are with that. So you would ask, how many for number one psychosis, have you had have you heard any hallucination in audio or visual? They may say, oh yeah, sometimes. So you'll mark a 1. So basically, at the end, you will really determine how many 3s and 2s you have, which are either, as you can see here, interferes with functioning, further action is needed, or number 3 is really disabling and dangerous, and basically intensive care is needed, which is usually TBS services. So this is one of the tools that's used. I know with in the county in social work, they use a safe measures tool as well. So no, safe measures is one of the other tools that's used to determine where the youth is at. I also, my understanding, some of the counties are merging both of these. So there's like a CANS 50 and a safe measures assessment is being combined. So they don't have to use 2 separate battery tests and take a youth through 50 questions and a whole nother list of questions. So this is the first one here. And then also there is the PHQ. I'm sorry, the pediatric symptom checklist. This is usually one for caregivers and usually younger youth. This is usually for younger, in between the ages of 0 to 5. It's usually pretty difficult to do something like this, but it's really simple. You know, you're going through this symptom checklist, and you're really going through and asking the patient directly, you know, so have you had any complaints of aches and pains? And you're numbering the system as you go through. And then at the end here, you have a total score that you're going off of to basically determine what further services are needed. So this is another test that's being used to really determine if a child can qualify. And this can also be used in the home too. A lot of parents can use this as well to determine if their child needs mental health services, or they feel maybe now, you know, with school being in the house, you know, is their child, they're more isolated? Are they going through levels of depression or anxiety? These tools can actually be used in the home. And there's also plenty of things online to show how to grade it and assess it. Brightfutures.org has a good website that explains how to grade and assess this test. So that's another one. And then I have another one here. The other one is the PHQ-9. This is the Patient Health Questionnaire, and this is actually something that people are very familiar with because this is actually used in most hospital settings. So whenever you go to like a doctor's appointment, and they, you know, now a lot of people notice now the doctors are asking them, is there anyone at home harming you? Is there anyone, you know, at home who's, you know, feeling depressed, or anyone in domestic violence? That's a mandate that's now been put in order for each practitioner to ask. And this is what they use here. It's called a PHQ, just to determine depression. And again, it's very simple. This can be used at home as well. It goes to, for example, number 1, and then asks, it's over a 2-week, like a 2-week span. So you're looking, so over the last 2 weeks, how have you been bothered? Have you been bothered by any of the problems? And it's 0 to 3. And then at the end, again, there's a scoring rubric. Again, there's a way to score this, and PrimeMD has another guide on their website if you're interested in scoring it. And for clinicians, here's the questionnaire, basically how you score the document. So it gives a little breakdown, and all this will be provided in the meeting as well. If people want to refer back to it, they can always refer back to this information as well. Also, for any viewers, you're welcome to ask questions. You can go ahead and put your question in the comment box, and I can bring it up, and I can bring up the question live, and then I can bring the question on the screen so everyone can see. So just as a FYI. So those are just a few of the tools there. And I know, as you were saying before, some of these tools are used in the court, but again, you see it from a referral perspective. Is that correct?
Yes. So for us, we don't actually do any of the direct services or know exactly how things are being made. We just read the essentially what is the outcome assessment. Sometimes you have a child who may be functioning in general well, school, etc., but they severely abused or exposed to domestic violence, they're doing well in school, or foster mom says they're fine, they don't qualify for this, and that is concern to the department, because the issue is that nobody's addressing your issues. If you've seen your father be several trauma there, but because the child may be a student, or the child acting out, it won't have this. But it know that some members will tell me, well, you know what to do, because when I talk to the client about that, they're very angry. But otherwise, straight A students. So, you know, when they go for assessments, they're always out, and they're not get any help. But fearful of father visits, we can't get they're not in therapy, So we can't get a therapist letter stating the child should have it because the child didn't qualify for therapy. So that leaves kind of conundrum. What do we do? Clearly, when we child, but we don't have a therapist to support that because overall, well, and doesn't qualify for service.
And I think that really relates to the ability and the level of the clinician and the social worker that they're working with, because I think there's several clinical criteria that has to occur in order for them to really catch some of those things. So, for example, you say they may be a straight A student, right? But then they may be acting up in class, or they may be acting up at home, and that comes down to really that clinical assessment from the individual working with them to be able to determine and even argue for the child. Yeah, even though this is going on, they may not qualify. It's only going on in one setting. Per the DSM, that is one of the criteria, or for example, ADHD, where those symptoms have to occur within the home and a school setting. And I think that's where the line might come in terms of, well, since that's the case, they don't qualify because it doesn't meet the DSM criteria. However, as you're saying, there's still trauma there. So I think that's work that still needs to be done in the area in terms of assessing within the field. And I think the trauma-informed care, that things are being worked on in the field, and really working on those assessment tools will improve that, in my opinion.
Okay.
I have another one too here I want to show, another assessment tool. And this one here is really related to substance use disorder assessment. So this one here, is that big enough for you there?
You can make it a little bit bigger.
Okay, let's see. Let's make that. There we go. Okay, are you able to read that?
No, but I can increase it on my screen.
Okay.
Okay, go ahead.
Actually, I want to make sure everyone else can see it, the size. There we go. Okay, so this here, and from my understanding, right now in the dependency court, and in terms of referrals and the assessment for care, this is a model that will be used in the future. But right now, in terms of the behavioral health department, this is one of the tools that's used to assess youth and adults for substance disorder. So in order to qualify for, say, substance use treatment, there's a certain level. It's called I just see here, it's the ASAM assessment. And basically this assessment shows really a period of how, what part a child falls in terms of the assessment. So ASAM, for example, ASAM 0.5 here. So basically there's a list of criteria that they have to meet in order to meet the lowest level of substance use disorder care. And that's 0.5, that's early intervention. So that's just someone saying they're thinking about, using maybe a youth between that EPSDT age, 0 to 21, that they qualify for. I'm thinking about using, so they'll fall under that 0.5 early intervention. So that will qualify them to receive services for education on substance use disorders, things of that sort. And then as it moves forward, as you see, like number one is outpatient services. So this is where maybe there's a use in the home now. Now youth are probably using. So this kind of shows the path. It's a little different than the other assessment tools, right? Looks a little different. So I just wanted to bring this up so you can see. It says here down here, there's 5 broad levels of care. It goes from 0.5 to 4. So it's a little different than mental health, assessing for mental health and qualifying for that. But just to talk about that, how much have you seen in terms of substance use within the youth and in the court? How much does that come up in your opinion? And do you see any challenges in that area?
I think we see it often because especially children that don't find permanency, children who have behavioral issues. So one thing is common is that if you deal with some mental health issues, they tend to not like the medications that they're being prescribed, and they begin experimenting with marijuana, which a lot of times uh, stronger drugs, stronger narcotics. So, and once they are, it's hard to decipher, um, you know, if they are just self-medicating, and then it's hard to decipher where they are educationally. So it does become common, especially with that don't find privacy or are in multiple group homes or home to home. Way more common to see them experimenting with substance use. Now, in terms of court services, we cannot force to enroll in treatment. It is that they have to consent to. So then that becomes complicated as well. So
Mm-hmm.
I know that when I was a minors counsel, a case carrying minors counsel, there was a very limited amount of programs for children under the age of 18 because it was not, there was a need, but there were resources. Now, as I practice, I see that there are more resources available to the youth, but whether or not the youth will agree to enroll in the service now.
And that's usually, and correct me if I'm wrong, but so even though you can consent for treatment, for mental health treatment at the age of 12, they cannot consent for medication administration as a minor at all. So they need that JV 220. They need the word of the court to basically approve that medication. Is that correct?
That's correct. Or if their parents consent, or if their parents are still involved, the parents can still make the determination. Nonetheless, the court has an obligation to supply the JV-20 so that it's a way of monitoring and to ensure that the children are not being over medicated. There is a history where children were being over, and because of that, that's why the court came up with the system to basically try to monitor the amount of psychotropic medication that is taken, and the minors count the ability to advocate for their client. So
Mm-hmm.
because of that, sometimes they have, I know of California referring to them because that's where a large part or majority at this point, um, colleges on and consult with. So if they any medication or a child and is taking medication, they can consult. Sometimes happen. They'll ask for assessment. So they'll bring this one be that their client to this to the judge.
Mm-hmm. And I'm glad you brought that up because I know about 5 years ago there was a lot of information out there just in terms of how foster youth, in particular foster youth of color, are being overly medicated more than any other youth in the field within the system. How does that look now? Is there any type of is that look getting better, or is that still one of the main issues? Or
Statistics to determine that, so I cannot tell you that per se. I can tell you that I think that I'm on the DCFS website trying to
yeah.
definitely do have fatality reports, but I don't have any reports on our website about particular. I
Mm-hmm.
would say I think it just varies. I think that in general, a lot of youth are brought before the attention of the court tend to have issues already. They're already they prior to entering and behavior issues, whether it be because they were drug exposed, whether there's extensive trauma, already have these issues. So um, they're more than going to have some issues. And so once they're placed outside of their, they definitely are medication, because sometimes they're being hard to deal with. So based on that, I think that they're more likely to be assessed for that.
I see. Yeah, and I know, I'm sure there's information out there for anyone that wants to see the statistics on that. GDSS also has some statistical information on there. On the screen here, I do have a one from the continuum of care reform. Some of their statistics on the race and ethnicity of children and youth in foster care who met the mental health screening requirements. And as you can see, a lot of within the areas, and this is from 2018-19. It's updated regularly. So I want to encourage people, if they want statistical information, they can go to that site to get this. It also categorizes percentage of youth and children and youth 0 to 20 who met the screening requirements. So this is another good resource for individuals who are asking for that data and that information, how this works. So yeah. I also have a, just in terms of resources, so I know you provide some great resources, and I want to just bring that up and see, we could talk about that for a bit. Let's see here. Give me a second. So trying to navigate all these screens. Here we go. Okay. So it's if you could talk a little bit about this here, and then just let everyone know what we're looking at, and then I also have it running down at the bottom too if the people want information.
So sorry, I provided a sheet that social workers can provide to caregivers when a child is having essentially a mental health breakdown. I had one a counsel call me and was stating that for some reason they couldn't locate the child's wraparound team or their practitioners, and they were asking, well, what services are available. So this sheet is one of the are available. Specifically, there's the access center where you can call for general services. One other thing is they're frequently called, or the PMRT team, so they're able to diagnose if the client is placed on a hospital, they threat to themselves. But I think that the society, we don't always 911 having health issues. Sometimes we do and use one of these hotlines, whether it's at school. So a lot of are issues that are in schools automatically call, and it's not a criminal, it's a mental health. In providing this to kids and providing schools, there are they can call having a hard time. So that's why we all of these folks. People have a help for youth without necessarily involving law enforcement. It's not necessary for the safety of the minor.
Yeah, and I know for those listening who are in other states, I know this is Los Angeles specific. That's where Melissa works at. However, some of these numbers are 1-800 numbers, and even if you do call these numbers, they can't route you to your county and provide you to that information in your area. If I'm not accurate, please let me know, Melissa. But I know some of these 1-800 numbers do have a, like, for example, the access line that's being scrolled at the bottom, that 1-800 number. That number will give you the area, the information for your area, wherever you're located. So that's just another FYI for that.
Correct.
Okay. And I know this is something new, right? That we're seeing, like, the partnership between law enforcement and social workers. How's that working now? Is it coming together as a good marriage, or is there still things coming in the future that things are being trying to roll things out? Just can you talk a little bit about that?
I don't have detailed information, so I'll just say in general, I think that all of the movements are definitely pushing counties and cities to reassess how they respond to crisis situations. I know that in the city of LA, which I'm sure the county of LA will adopt, they are looking at creating more crisis management teams so that law enforcement have to be the first ones dispatched. So the funding, so that other professionals dispatch as well. I think that funding remains an issue, right? Because a lot of funding. So for law enforcement, that is something that we're going to see in our legislation. So I think that's a big part of when you're voting. Are you reading all the news that are coming up? Especially, I think election, we are going to see a lot of laws, and how do we pressure on local politics to address these issues within our community? And I think different parts of the community have different ideas on how it should be acted. So I think that this is an issue, a hot button issue, right? People on both sides are uh, very passionate about, I think, the city, the state, and local to respect situations. And so I do think we're going to see recurring, and we're going to see a lot of change. We have some stabilization. So right now, I don't know that we have all of enough resources to respond to of need.
And I know that's something even here in Sacramento that it's in the works in terms of finding the funding within the budgets, the city, the local city and county budgets to be able to fund these individuals to go out, these social workers to go out with the police. And now I know another question is being raised, but how about the danger in terms of social worker going into a dangerous situation, and how do they ensure that the law enforcement is with them at the right time, and what type of liabilities are there? So I know those are some of the issues that have come up just within here in Sacramento.
I think that those similar issues are being addressed in LA County as well.
Yeah, and I mean, you can imagine, someone who's disarmed and all they have is, pretty much their basics, as a mental health professional, and going into that environment, it can be dangerous, but I think it's better to have someone there to address those mental health needs, and really mitigate some of the things that are happening due to mental health issues and not necessarily a criminal issue. So.
Yeah.
So I have the resources here, and I want to make sure if anyone is interested in this information, we have the information scrolling at the bottom. Also on the website, I'll include that in the chat box as well. If anyone's interested in those resources as well, and also I just wanted to give a heads up for everyone. We will be working on doing more of these conversations. So just really stay tuned. And before let's see, Ann, I just want to see if we have any questions here.
Sorry.
Let's see. No problem. Okay, here's a question. Okay, question. How have the courts process been impacted handling incarcerated parents in hearings?
So like I said, if a parent is locally incarcerated, like within for LA County, I cannot speak to any other county because I've had friends from other states call me and say, hey, are the courts still down in California? And referencing county in Santa Clara, stating that they're not taking new filings, however, and I'll say, no, it's different. I want to say, everything is counties are others where you live, your state, it might be different. For us, we can bring out, but we're not. If a parent state custody is not able to, however, some have set parents can they can participate in WebEx as long as minute order, as long as there is substantial notice of when the hearing will occur, parents can participate.
I see. And I think that make sure I answered their question there. Okay, yeah. So they said that answered their question. I think a couple other ones they have here. I think we pretty much addressed them all. What determines if psych services are needed? So we addressed that question. What are the challenges in referring a youth to psych services? I think we touched on that briefly, those challenges there. And what is the criteria? Children aren't meeting the criteria even though they show trauma. We discussed that. So yeah, I think we covered all the questions here. So I know we have our time all the way out for another 15 minutes or so, but what I'd like to do is just let everyone know that we will just stay tuned for more of these conversations. We're going to really be diving into these conversations in different topics. And if there's no other questions, I just want to see, Melissa, if you have anything else to share before we close.
Oh, thank you for inviting me. I was glad that I got to learn about how families are assessed. I'm hopeful that the way minors are assessed will change so that parents, families can receive the services that they need so that they can be whole. But otherwise, now to add.
Well, can you say that last part once again? I think it cut out a little bit.
I have nothing else to add.
Okay. Okay, that's perfect. Well, again, thank you for joining us. And again, this will be posted, the recording will be posted on my social media site. So if anyone wants to go back and take a look at it and review it over again to see some of the resources and information, if they weren't able to capture it, it'll be there. And also it's currently in the chat section now. And thank you, Melissa, for joining us, and everyone else. Stay tuned for our next episode. Stay tuned for the next topic. I'll put that out on the social media platforms. You still there? Okay. I'll talk to you later, Melissa. Okay, bye.